budget will come back into session. And our next item on the agenda is the Family and Children First Council to be presented by Ms. Robin Martin. Welcome to the committee. Please proceed.
Good afternoon, Mr. Chairperson and council members. Family and Children First Council, we serve to unite. I'm sorry. Can you hear me? Yeah. Okay. We serve to unite public systems to help them implement policy changes that will plan services for children and family, troubleshoot recurring problems, share data and information, collaborate to reduce costs, and reduce involvement and length of stay in public systems. We also promote youth development models that prepare children for healthy and stable adulthood, support programming and planning that increases the self-sufficiency and decision-making abilities of families, and better connect services a child really needs. Our budget for 2012-2013 is $4,256,283. And you see a list here of our funding resources. We receive a 6% from philanthropic community, 31% federal and state funding, and 63% Health and Human Services levy. The next slide on page 4 shows a high-level breakdown of our funding. And the majority of our dollars, 79%, are allocated to contracted and professional services. Our services are dedicated to 3 areas: service coordination, which is about 13%, Children's Trust Fund, which is about 17%, and child well-being, which is about 68%. And the 2% other covers an audit that we are required to implement every year that is separate from the county audit, where they audit not only our dollars, but they also audit us on procedure, because there are some specific things that we're required to do by statute. The auditor for 4 years, the state of Ohio, does the audit, and then for 4 years they release an RFP and select a local auditor. We are a part of the RFP process in terms of selecting the vendor. However, they have the final say and we receive the bill. Included in that 2% is our portion of the communications budget. The Cleveland Foundation pays a separate portion of communications for MyCom. Out of our funding, we cover MyCom and other issues related to council, because in the statute, there are some things we are required to communicate to the community. And lastly, in the other category, we have a portion of funds set aside to travel for MyCom, and again, those are philanthropic dollars that cover the travel costs. On the next slide on page 6, you see a full breakdown of our contracts and how our dollars are allocated across each of the areas, with our highest dollar amount going to out-of-school time / transitions for kids. And out-of-school time really looks at programs in the community that children receive when they are not in school. On slide 7, here's a breakdown of our numbers served for 2010-2011. Under the wellness program, which actually started out years ago as a wellness block grant, and the community decided to keep it going after the block grant was removed because we have a high teen pregnancy rate. In 2010-2011 school year, we served 5,141 fifth through 8th graders. Under families and schools together, we serve as many as 260 families a year, and this is our projected number for 2011-2012. And I put that in, even though it's the current school year, because this is the first year we have taken FAST back in-house, where we actually operate it versus using an outside vendor. With our wraparound funds that we received from the state of Ohio in 2010-2011, we served 913 kids And just like the two organizations that preceded me, we do not provide direct services. We manage and coordinate the youth system for kids kindergarten through graduation. So we have lead agencies that do the majority of these operations. Under Children's Trust Fund, our vendors serve 250 families, and the Children's Trust Fund, their dollars that we receive from the state of Ohio, and they are earmarked by statute to serve families to prevent child abuse and neglect. So these are families that cannot be known by the child welfare system. And we also, through our 211 call center at United Way, we were able to answer 1,553 calls to help families, directing them to services to prevent them from system involvement. Our out-of-school time pilot, and we've been in a pilot phase for the last 3 years, and we are moving to a countywide system in September of 2012, but in the previous year of the pilot, we served 3,104 kids across 18 neighborhoods. Our Youth Advisory Committee, which I think you all have met at a meeting a couple months back, we have 63 active members, and these members are young people from all over Cuyahoga County. We have kids in the inner city, first ring suburb, and outer ring suburb. It's a voluntary program, and the children come in and they learn youth development skills. We have had young people join the program, and when they joined, they would have been afraid to stand here and present to you as I am doing today. But after working in the program for 2 years, they are out in the community presenting to adults and having conversations around youth issues and really having their voice heard. The program is becoming nationally known, and they have been asked by Washington, D.C. to work with them on the development of a national youth council. And then lastly, we have a parent advisory committee, which we are required to have.
Excuse me, can you hold on just a minute?
Yes.
Ms. Conwell has a question.
On that point that you just mentioned, were those youth part of the Youth Summit, the third annual Youth
Yes.
Summit this past
Yes.
Saturday?
Yes.
Councilman Rogers,
Yes.
as well as I, attended at different times of the day.
Yes.
They were dynamite. They were in the classroom. I actually visited a couple of the classroom settings, and you had these youth standing up there presenting, as Ms. Martin is, to other youth, whether it was poetry slam, teen pregnancy, you name it. And I always say that's to my children, they learn better from their peers versus than us. I mean, we say it over and over. So,
And that whole event was planned by the youth. We help with the adults, we help with the logistical pieces of it, but what happens during the day is planned by those young people.
We also had a MyCom presentation at the Ward 18 Neighborhood Summit last week as well. So they're out there.
Good. Lastly, we have a parent advisory committee that we are required to have, and we have 28 parents active and 17 parents waiting for training. And the parents, we use them for several reasons. Family and Children First Council, our office, we are not the actual council. We're the staff to the process. We make things happen. We are required to have so many parents sitting on the council. And so through this process, they are trained to participate in those Family and Children First Council meetings. We also support the Department of Children and Family Services because they have all been trained as surrogate parents, which means that they can participate in the IEP process, the individual education plan process. So it requires the sign off of a surrogate parent who cannot be an employee of Children and Family Services, and they can also not be the foster parent. So you need a surrogate parent to sign these documents. They serve in that capacity. And lastly, we receive a pot of dollars from the state of Ohio for wraparound. And one of the caveats to the funding is if a family calls in and requests a parent advocate during their family team planning process, we provide the advocates for that process. And it comes from this group. A quick overview then these are things that are either in process now or coming up next year. Under service coordination, we are going to add a new state funding stream called Home Choice. And Home Choice looks at children who are transitioning out of a hospital or residential treatment setting. It provides $5,000 per child to aid in their success once they return to the community. Under child well-being, as I mentioned earlier, this is the last year of the pilot for out-of-school time, and so we will open up the services countywide based on the lessons we've learned over the last 3 years. Under MyCom, we are merging several of our MyCom components for better service delivery. As I said earlier, we have taken FAST, Families and Schools Together, back into our office where we're actually managing it in conjunction with the Education Services Center. They serve as the fiscal agent paying the bills, but our office actually monitors the program and provides technical assistance to the family teams. And we are also looking at providing some funding for unsubsidized youth employment. And this is really looking at scholarships. Now, I know we have an Office of Workforce Development. They are going to work with us on this. However, the funding that Workforce Development currently receives is federal dollars that is earmarked for families who meet a certain poverty level. We are looking to this funding for families that do not meet that requirement, yet their children want to work and they want to be a part of internships that will lead to college. So we're really using this as a strategy to promote college, linking it to their college goals. And lastly, the Ohio Children's Trust Fund is planning on implementing a new state model in the upcoming state fiscal year 13. And so we will be working with our local council, who actually serves as the local board of the Ohio Children's Trust Fund, to implement those new strategies. And that is the end of my presentation, and I'm ready for questions.
In the chart on page 6.
I'll go back in the book.
Could you just run through the top 4 or 5 categories and tell me, my color coordination is not quite good enough to
Sure.
always be sure of which corresponds to which. So which is the 42% and which 2 are the 12%, and give us a couple of the top items.
Okay, I'm gonna start at the 6% at the top to the right. The 6% is wellness.
Wellness, okay.
The 12% is FAST.
Fast.
The next 12% is families and schools together. I'm sorry.
Okay.
The next 12% is wraparound. I'm not color coordinated. I'm off one. Okay, I'm sorry. Let's start at the 7%. I apologize. The 7% is wellness.
Let's start from the top.
Yes, at the top, the 7% is wellness. The 6% is families and schools together. The 12% is wraparound, the first 12%. The second 12% is Ohio Children's Trust Fund. The 1% is communications. The 42% is out of school time. The 3% is Youth Advisory Committee. The 4% is Parent Advisory Committee. The 1% is the audit. The 3% at the top, the 3% at the top is the unsubsidized job slots, and for some reason it did not pick up the evaluation, but the 0% is travel. I did this in Excel, so I'm not sure why that happened, but it looks as if the MyCom evaluation was not picked up in the chart, so I can redo it and send you a revised copy.
It's close enough.
Okay.
Okay, that gives us the idea. Questions by my colleagues? Councilman Rogers, to begin.
There are neighborhood collaboratives
Yes.
that are various social service agencies that are geographically associated, and they meet on a regular basis. Is that out of this office? Are those managed out of this office, your office?
To the councilman through the chair, the neighborhood collaboratives are managed out of the Department of Children and Family Services. However, we do work with them for our community assistance program, where we provide a one-time payment to families, and typically they're families who've recently lost a job or are going back to work and need a one-time payment to keep them from spiraling out of control. They have applied for assistance from other programs and have been denied, and as a last-ditch effort, they go to the neighborhood collabs and they work with us for that one-time payment to keep them going. But we do not have the official oversight of the collabs.
Great. And lastly, does your department work directly with schools and school districts?
To the councilman through the chair, yes, we do. We have worked very closely with Cleveland Metropolitan School District. We've worked with Parma, Shaker, I'm drawing a blank now, Warrensville, Maple Heights, Bedford, and historically, we've worked with Garfield, Lakewood, and I think that's it. But we have a very close relationship with the Education Services Center, so whatever we are not able to accomplish directly with the school, we use them as an intermediary to still meet the need.
Thank you.
Questions? Okay, Ms. Simon.
Thank you to the director. You stated that part of the system that intervenes, and rather than the kids getting into the system, you provide some interception of that. What kind of services would be provided to these kids or families before they get into the system?
To the councilwoman through the chair, as part of wraparound, what we do is we've worked with the neighborhood collabs over the years and some of our other providers, and they actually have family meetings because we recognize that every family is different, and in each family, they develop a plan, and then based on that plan, we provide supports. Oftentimes, one of the biggest needs is something related to out-of-school time. If it's a public systems issue, even though it's our goal to try to divert them from the system, there are times when we have to go ahead and assist them with a referral, but we also work with the public systems to keep their length of stay minimal.
Okay. Anything else? Ms. Conwell.
Through the chair to the director, you stated that in staffing levels that you had a business service manager. You have a vacancy. What did the business service manager used to do?
To the councilwoman through the chair of the budget, anything fiscal, all of our bills worked with our providers around ensuring that they were meeting reporting requirements. And even though we are a county agency, we have our providers report to meet the requirements of county, state, and federal. So they have to submit all of their bills to us before we will process an invoice. And that individual went through those bills almost like an auditor to ensure that we received everything that was accounted for on the invoice before we pay anything out. And then anything related to our budget, and working with our auditor at the beginning of each year to do the Family and Children First Council audit.
So the auditor's doing these.
My business services manager serves like as an internal audit function to make sure that we have everything from when the state auditor comes in, we have everything available to try to keep the audit as short as possible.
So who's doing these functions now?
I am.
And so I know you have a vacancy. Is that the vacancy actually in the 2012 base budget, or you didn't to fill that void, or you didn't?
There is no request in process to fill that position.
Thank you.
Okay. Thank you very much.
Thank you.
Yes.
Thank you, Mr. Chairman, members of the committee. One of the things that the Department of Health and Human Services is working on with respect to the offices in this division is working to coordinate what has been referred to as the backroom services. So as where each of the 3 or 4 offices had their own financial person, it really is our hope and intent going forward to share those resources. And that was at least perhaps implicitly and perhaps explicitly referenced in our structure when we align these offices within that division of community services, or community initiatives rather, excuse me.
Okay, thank you.
Thank you.
Okay. Last but not least is the Office of Reentry, Louis Vasquez.
Good afternoon.
Welcome to the committee.
Thank you. Good afternoon, Mr. Chair and members of the council. First of all, I would like to spend a few minutes talking about the mission statement for the Office of Reentry. The mission of the Office of Reentry is to assist policymakers, community leaders, and service providers to identify the reentry challenges facing Greater Cleveland and work to target resources towards sound, comprehensive, and cost-effective solutions. If you look at your PowerPoint page number 3, the overarching goals is to increase public safety, reduce recidivism, and we'll pay very close attention to the fact of the issue of recidivism and how important that issue is for our office as we move forward with our contracted services providers. Number 3, we provide coordination between the various government, community, and faith-based organizations that provide services to the reentering population and to ensure sustainability of the reentry service delivery system. If you look at page 4, we're looking at restore citizens returning to Cuyahoga County, and really it's important to note the numbers and the compelling case that we have in our county. Approximately 24% of the state's prison population returns to Cuyahoga County. Approximately 6,000 prisoners return to Cuyahoga County each year. More prisoners or ex-offenders return to the city of Cleveland than any other city, and that is approximately 18%. 5 of the 36 neighborhoods in the city of Cleveland received 79% of returning prisoners. That is Huff, Central, Glenville, Mount Pleasant, and Union Miles. And those numbers, when we looked at the 6,000, those are, you need to start counting 6,000 every year. 6,000 in 2007, 6,000 in 2008, so those numbers don't change. We put in around 20% of the intakes at the state facilities are coming from Cuyahoga County, and around 24, sometimes 25, 26%, that is an approximate number, return back from our state facilities. County jail also reports approximately 14,000 individuals who spent over a day in their custody and were released directly to the community. Those 14,000 that are part of the county jail, that's also part of the reentry world. There's approximately, and I didn't put the slide on this, around 1,900 that are on federal probation, and we do service some of the individuals who are on federal probation. Quite a few of the individuals who are on federal probation get services through the Federal Probation Department. If you look at slide number 7 under funding sources and expenditure summary, the total funding that has been recommended is for $1,888,426, and that is 100% levy funding. Before I really looked at the expenditure and the amount, I think it's also important to note the Office of Reentry was funded for the first time in 2009. We're going into the third year of funding. And we've been able to leverage through public-private partnership for the last 3 years over $2 million. Even though our reentry services, or the Office of Reentry has been a relatively new office, reentry has been in the mindset of this county for many, many years. We've been very fortunate, very, very fortunate to have worked with, created some very true public-private partnership with the Cleveland Foundation, the Gun Foundation, as well as United Way Services. And combined between those three and some federal grants, we've been able to leverage over $2 million for the past 3 years. And I really want to applaud both of the local philanthropic entities, the Gun and Cleveland Foundation, because they've really stayed very true to the core services as it pertains to reentry services in our county, and we're continuing to really nurture that public-private partnership. As we go on to page 7.
Excuse me just a
yes.
minute. Did you say 2 million or 3 million?
Over $2 million in the last 3 years we've been able to leverage between
And is that over the 3 years or per year?
for the entire 3-year amount.
During the 3 years?
During
2
the 3
million.
years.
Okay.
Yes, Mr. Chair. Under salaries and fringes, for the 2012 budget is $476,048. Other operating expenses, $90,378. And in contraction services, $1,322,000. If you look at the pie chart on page 8, you'll be able to see that 70% is going into contractual services, that is direct services. Between 2009 and this upcoming recommended budget, we've stayed between 70 to 82, 83% in putting our dollars in direct services. For that, we feel very, very proud of because we really want to put as many dollars as possible into direct services based, as you look at the numbers, on the compelling case that we have in our county. If you look at the contractual services expenses that we're allocating, and I also provided you a separate document aside from the PowerPoint that starts with this adult education basic services that kind of breaks out in details what each program does, and also some of the results and outcomes for 2011 that we just presented at the public meeting on October 21st. Project Learn is our literacy program. It provides adult education services in Cuyahoga County Jail, from basic education all the way to up to GED level classes and testing. In 2011, this is a major achievement. Project Learn was able to give GED tests to inmates still in jail, and that there's a real strong, a long time process to be able to accomplish that, and that was able to be achieved. We're also doing GED testing now at the North Star Neighborhood Reentry Resource Center. The Common Pleas Reentry Court, which addresses the needs of offenders transitioning from prison back to the community, we're allocating $60,000. And there's a one-pager here that I provided this afternoon on court reentry. And if you look at court reentry, I think it's important to look at the figure of $2 million, almost $3 million in prisons days saved, which is at the per diem rate of $66.56. And that's a program that we're only investing approximately $60,000 in 2012, but you can see the results as a specialized docket that Judge Nancy Margaret Russo oversees. And she was also part of our public meeting. Actually was the keynote speaker for our public meeting. We are going to do an RFP on employment and training. For the last 3 years, Towards Employment had the contract for employment and training. After the third year, which has been sort of standard practice, we'd like to put out another RFP for employment and training for a figure of $375,000. We are also going to RFP a pre and post case management program. The Center for Families and Children, through the Greater Cleveland Reentry Integrated Project, had this contract for the past 3 years, and we'd like to put a new RFP of $475,000. And we are slated to allocate to the North Star Neighborhood Reentry Resource Center the figure of $345,000. I believe you also have a one-pager on some of the services that have been provided by North Star, and also in the other packet that I also provided for you, you'll be able to see some of the results of the North Star and how many individuals have they faced. I know that, Mr. Chair, there's members of council here today that are very familiarized with the North Star Neighborhood Reentry Resource Center and the services that have been provided. We wish we could have had 2 North Star Neighborhood Reentry Resource Centers when we first put this particular contract together, but due to the lack of funding and limited funding, we're only able to open 1 North Star Neighborhood Reentry Resource Center, which happens to be also, I believe, in District 8. I believe is North Star is located, and that's one of the areas where we have a high concentration of returning ex-offenders coming back to the Cuyahoga County and to the city of Cleveland. In terms of quick review, and I know that Director Warner talked about it for a few minutes this morning, there's been some staff realignment which has resulted in an increase in the staffing level for the Office of Reentry and corresponding increases in salaries and fringes expenses for the agency. The staff increase resulted from a decision to move existing staff already working on reentry since inception from the Office of Health and Human Services to reentry in order to properly and align staff with the functions that they are part of. At this point, I would like to entertain any of your questions that you have for the Office of Reentry. We want it to be as succinct as possible, so I'll give you some opportunity for you to ask me some questions.
Thank you very much for your presentation. I assure you that this is a topic that's of great interest and concern to the council. It comes up frequently in a variety of settings in our discussions of various pieces of legislation and contracts. And I now turn to my colleagues for any questions. Councilman Jones.
Through the chair to Director Vasquez. You know, from the state level, there's going to be a greater influx of those with felonies on their records coming back to the community. What is that number above what you, is it quantified yet what we think is going to, the increase will be like?
Mr. Chair and Councilman Jones, that's an excellent question. As you know, this year House Bill 86 was came into law, which is sentencing reform. As you're aware, there's a committee already established, and I will get to your question, but I think it's important to really highlight what is happening from the state level standpoint. There's a committee that has already been established by the Ohio Department of Rehabilitation and Correction, which is on justice reinvestment dollars. There's two members of that committee from Cuyahoga County, Bo Hill, who is the Director of Salvation Army, and Mark Randall, our new community-based correction facility director, and they're representing our county. One of the challenges when it pertains to House Bill 86 is that we stand to have the most returning ex-offenders coming back to our county. And it's really important to note, in a study that was done by the Council of State Governments in 2008, 31% of the admissions, that means statewide admissions, to our state facility are felonies 4s and 5, which are low-level offenders. So we have many low-level offenders, which we expect that they will be returning. So if we look at the math, and if we look at the fact that around 25% are returning back to our county, there's around 54,000 who are being housed right now in our state facility, we're looking at a figure around 1,500 to 1,700 easily within the next 2 to 3 years returning back to our county. They indicated there's going to be a trickle effect. We're working very closely with the Ohio Department of Rehabilitation and Corrections. We have made a request that we would need around close to $4 to $5 million returning to our county to really serve those individuals who are returning if by chance there is a large amount coming at once. We don't expect that to take place. They've sort of worked very closely with us. They know that we have the most returning individuals, and they have been working I think in a more amicable fashion, so to speak, with us in learning what our compelling situation is. So we're expecting a number of them to be released that really are not indicating at what point is there going to be a mass release per se. I don't think that's going to be the issue. I think that they will hold to the word that this will be a very small trickle effect and how this is going to take place. But there's a lot of pieces in this bill that are still being worked through. This is not while it's in law, there's a lot of processes that are still being worked through the Ohio Department of Rehabilitation and Correction.
Mr. Gautner?
Thank you, Mr. Chairman. Mr. Chairman, I just wanted to bring to your attention and to the attention of the committee that Mr. Vasquez, like many of his colleagues, has been very aggressive in seeking other sources of funds as well. And it's my understanding that the Office of Reentry has recently been notified that they have been awarded and the county will receive a federal grant that effectively increases this budget by about 50%. It's over $600,000, if I'm correct, Mr. Vasquez.
It's $685,000 that we just received to the Second Sancheck dollars for reentry demonstration planning and demonstration projects, which will help us sustain one particular program that is the Severe Threat Group, that is the Anti-Gang Initiative. We were able to fund that program through a one-year allocation of $100,000 federal appropriation dollars. Those dollars are no longer earmarked. So through this particular grant that we obtained, which was a highly competitive RFP, we're able to sustain that as well as part of the high case management model that was under the Greater Cleveland Reentry Integrated Project.
Okay, back to Councilman Jones.
Well, we know there's a great need that's already exists and it's growing. Talk a little bit about the towards employment and the completion rate and how they've transitioned into work. What success are you having there?
If you look at your document, which I provided the data from last year that I provided in the public meeting, they are, and if you look at the, let me give you the actual numbers. From July 1st of 2010 through June 30th, 2011, that is their fiscal year, their contract year, 187 participants completed the program, and I think they were contracted for about 150 to 155. The program is expected to achieve this required benchmark, where 70% of program completers will achieve job placement, 60% of program completers will achieve 30-day job retention, 50% of program completers will achieve 90-day job retention, and 45% of program completers will achieve 180-day job retention. They are in line to meet pretty much all of those benchmarks. We will know the final results by December of this year, when they will provide the final numbers. And I think it's important to note, because through the Network for Success program, historically research will tell us that there's two issues that happens with the reentry population that are much in need of. One is employment and one is housing. But if you don't have the other wraparound services in place, if you don't have the other support services in place, just that by itself will not stop someone from recidivizing and going back to prison. There's many, many issues that you have to address with the population that's returning, and that's why you have the North Star Neighborhood Reentry Resource Center, which I indicated to Council and to the Chair, all of the services that are personally being provided, and is a relatively new facility that opened in February of 2010.
There are many who are couch surfing. They are obviously committing, there are some, and certainly not just in this arena, but those who are committing crimes every day in the neighborhood. It appears that you're making an impact when they plug into the pipeline that you have here, whether through G-Church or through your North Star Reentry program. So you are making an impact, and a positive impact. My question is, seeing what you've done, tell me your administrative costs. What percentage of your administrative costs to your budget?
If you look at the initial PowerPoint, 25% is now slated for $1,000 salaries and fringes out of the 100% of the budget.
25%?
25%. Our staff is a staff of 6. It's a relatively small staff.
Excellent. Okay. Where would you see dollars going that would really help in this entire pipeline to help move, continue to help move this community towards self-sufficiency?
I think one of the things that we're taking a very strong look at is the issue of expungement, which we'll be working very closely with Shaker Municipal Courts. We'll be doing some piloting issues at Shaker Municipal Court through Judge K.J. Montgomery, which has been, and I really want to applaud her for her initiative and for her commitment to reentry, and consistent commitment to reentry, and one that holds me very accountable as I lead this office. We're also looking at how we, and I see this from a performance benchmark standpoint, at the issue of recidivism. In our county stat this year, while we have one of the lowest, and I think that's attributed to the programming component, of around 37% recidivism as a state, not just as a county, we need to take a look at how we continue to lower recidivism, because at the end of the day, if we're not able to lower recidivism by at least 5 to 10% in the next 5 years, then I don't think we're doing what we're supposed to be doing and doing our job correctly. So it's really key that we look at the issue of recidivism and how we continue, because as we look at the cost of incarceration, it's $26,000 that we're paying for an individual who is in our state facilities. And it's only $5,000 if we provide optimum treatment, and not everyone gets optimum treatment. So when we do the math, we see the numbers and the disproportionality regarding the cost. I think that we also take a look at, and one of the things that I think is particularly compelling to us that I've been talking with my staff is what I call children of incarcerated fathers. There's a study that was done by ODRC, it was provided about a year or two ago, and there was a sample study of all the counties, and I can provide the study for you. In 2008, over 55 to close to 60% of individuals who are incarcerated in our state facility have come through the juvenile system in our county. And I think that number was very conservative. I think it's a little bit higher than that as we speak today. So those are issues that are very important. But one that also stands out for us is also how do we really evaluate this model? We are by far the county that's taken the strongest lead as it pertains to reentry from a government-based standpoint. Recently, Hamilton County finally have a counterpart in Hamilton County, Deanna Hoskins, which also will be spending around 4 or 5 days here in November looking at our Office of Reentry and how we do business of reentry in our county. But that's the second Office of Reentry that opens that is sponsored by government through the Commissioner's government setting in Cincinnati. So while we are sort of far, a little bit ahead of other counties, we need to be able to really validate this model empirically. And I think that the evaluation component is really key. And as you know, evaluation is something that I think we can seek some private dollars and really look at the fact because, we have a very good case here as we move forward.
I don't think I've seen a better percentage of administrative costs. The United Way had a lower percentage administrative cost to services. Have you collaborated at all with workforce development?
Yes, actually, we have worked with workforce development. We actually have a request for proposal that we are in partnership with the Cleveland Foundation and Social Enterprise, and we have been working closer, even closer, especially now since Director Rimes is at the helm and has been a very strong supporter of reentry. So we're going to continue enhancing our relationship with workforce development as it pertains to the reentry efforts.
And Mr. Chair, one final question. What type of costs are you putting towards entrepreneurship? I know you have an event coming up, a workshop. Is this the first time? Have you done it in the past? And what type of dollars are earmarked for those type of endeavors?
Well, let me go back for a couple pieces. First on the event, and then also from the committed dollars to entrepreneurship. Through the federal appropriation dollars, we put $130,000 into a program called the Reentry Reconnection Grassroots Coalition. The Reentry Reconnection Grassroots Coalition is a program that I think will continue to be supported through working on some private entities right now, and it's at a grassroots level. The Community Endeavors Foundation oversees this program from a fiscal standpoint, and we feel very, very excited about this particular program. But we're more excited about the social enterprise request for proposal. There are 4 finalists for this, where we leverage $400,000 that we encumber from our 2011 budget. The Cleveland Foundation is leveraging $200,000 for a total of $600,000 for social enterprise, and there's 4 finalists. We actually will be making a decision by next Monday, by November 7th, November 8th. There's more slated to meet at the Cleveland Foundation to make the final decision. So who, whether one program, one entity, or 2 entities can be awarded. And that's creating true reentry jobs, true sustainable jobs, because social enterprise could be in the business of catering, could be in the business of greenhousing, green laundry, all of those pieces. And we're also going to be attaching, since this is kind of a new concept, a business mentor to whoever is going to be awarded.
Okay. I'll defer.
Okay. Are you done for now? Okay. Councilman Tron.
Thank you, Mr. Chairman. Mr. Vasquez, you indicated that the training and preparation is something that's going to be critical in the GED program. Can you tell me what it is you're trying to train people to do, and where do you see them ending up on the reentry?
As it pertains to GED, it's actually obtaining the GED.
Yeah, GED is step 1, and then ultimately you need to do something from there. What are you
ultimately, we're looking at all the pieces. If you look at the services in the North Star, there's a one page that I gave you, provided for you. You have to look at this holistically. You have to look at the employment component. You have to look at if there's a substance abuse program issue, if there is a life skill issue. There's a number of issues that are part of the needs of someone who's returning back. And that's why we really put the dollars into this Neighborhood Reentry Resource Center, because it is what it is. It is a resource center that addresses all of the many needs that an individual has. So upon them coming back to our county, either themselves or the family, were able to be assessed and screened as to what particular services are in need. And that's where the catchment is in that particular area. So ultimately, what you want is to prepare the individual to be self-sufficient, and that means in the area of employment, in the area of housing, and the area of any other issues that are creating obstacles on their ability to be self-sufficient.
I understand the North Star services to try to eliminate any constraints that might prohibit success. You also have the GED for the initial training program. What are you doing following success on the GED? I mean, what are you training people to do?
Well, if the individual, if the GD, we can hook them up with our contact service provider, they can go to our towards employment component, which is employment and training, and you have I believe I provided you an explanation of the particular program. It's hooking them up in whatever services need, and that we will be able to receive that information from our county jail prior to the individual being released.
Are you working with the workforce side of the aisle of the county at this point in time?
Correct. We are.
Once they get their GED?
Correct. We're working with workforce development, establishing even a stronger partnership than the ones we have established, because we already have contractor services provider through Towards Employment, which is a relatively healthy contract, for lack of a better term. We're able to get them hooked right into that Network for Success, which is a workshop training component that prepares them for the job and looking at soft skills and hard skills, so they're totally prepared. And I will say, we have a company, Metal Fabricating, who has worked very closely with Towards Employment. This particular company on Berea Road and West Boulevard has hired approximately 30 to 40 individuals who have come from the Towards Employment program and had a 90% success rate in hiring full-time through the Towards Employment program. But I think it works very well for those companies because those individuals have sort of come to a customized approach and through that pipeline, and they're more ready for employment, more motivated once they complete that program. So it's from a continuum of care services.
More than likely, you've identified that these 24% are coming back to the county, and you have some good idea of who they're going to be?
Yes, because if you look at the figures of the fact that 31% of the admissions in 2008 were low-level offenders, we have a pretty good idea who's returning. That doesn't mean that everyone who's returning is in need of services. We just have to look at the complete figure and to realize what are the challenges ahead of us as we prepare and we move forward.
We had testimony from the Workforce Connections folks that they have also identified some of the job classification needs. Are you linking to making sure that those are getting plugged back in before they ever leave the institution to come back here, so they have some kind of an idea, some kind of a hope as to where these jobs might be?
We have a Welcome Home Guide that we also have funded through United Way for Services. Welcome Home Guide is a booklet that has all of the services that you can imagine from the reentry population returning back to our county. But to the chair and to Councilman Strong, one of the challenges that we have is the issue of collateral sanctions. And that's very important because not every job is available for someone who's returning back. There's certain jobs that an individual will not be able to work in because of collateral sanction. We're working very closely. As a matter of fact, the governor is actually sponsoring a collateral sanctions summit coming up here in November through the Ohio Department of Rehabilitation and Corrections, and looking at the fact that many of the jobs that should not have the type of collateral sanctions that they have, they need to be somewhat not eliminated, but being able to give an opportunity to the individual rather than not be able to work in some types of employment. So their issue of collateral sanctions is very key because it's creating some key obstacles for individuals to return to a particular jobs that they might be interested in. So there's another challenge that we have, very strong challenge that we have in front of us.
But I'm sure Mr. Reams could tell you exactly which jobs where he has a collateral sanction issue and which ones he doesn't. So
correct.
We can get started. It ultimately brings me back to the budget issues on here, that I see that you have identified almost well over $850,000 worth of RFP, and you identified that at $5,000 per individual, you could get the maximum provided benefit and services to anybody in that sector. Why are we spending money on RFP as opposed to actually putting it into actual programs and use? Because it sounds to me as though you know your program. Based on what I'm hearing, you understand your issue. You understand where they're going to be coming from. You know and understand where it is. Why not put it to actual use as opposed to sending out to consulting firms to do RFPs for these two programs?
Well, those are services that we need to provide, and as a result, we usually do our contracts on a 3-year basis. So our third year has to be pretty much standard practice that you go out for another proposal rather than give the same amount of dollars to the same entity. It doesn't mean that we're not satisfied with that particular contracted provider, but that's why those areas have been identified as priorities in terms of putting them out for an RFP, which will be encompassing of the services that you're alluding to through this particular service.
It just seems a shame to be taking what amounts to almost a third of your budget and using it for studies as opposed to putting that third to actual work to
Well, this particular figures, let me correct this. The 375,000, that's for employment and training. That's the new RFP. That is the same type of programming that Towards Employment Agency has provided for us. But again, they have gone into the third-year mark. The pre and post case management program is one that we've already funded, but is again at the third-year mark, and we're going for a new RFP based on the 3 years that we have put as a kind of as a standard in terms of requesting the same service but through an RFP process.
Thank you.
Mr. Chairman?
Because I am going to defer to Councilman Jones.
On the, after they received, a person has received a GED, in your estimation, when it comes to some post-secondary education, would those that you serve be better served by following a path of vocation or 4-year degree? I don't say better served is the right term, but where do you see that they gravitate to?
I think this also depends on what kind of interest the individual has. I think the GED is a motivating factor that they're able to achieve. And the fact that we have a captive audience at the county jail really gives us a good prognosis. And that's just where I think one of the things that we want to establish even a stronger partnership is with the community college, because I think many of these individuals have the potential to also come into higher education and to be able to get those types of degrees. I think that's one of the keys that we're also looking at as we expand the services to North Star. Again, the North Star is a relatively new facility, is how we look at secondary education for the individuals that you're alluding to.
Do you have any sense of how many are actually going on to receive a 4-year degree? Is there, that might be beyond your scope after, but.
Actually, it's I know Justin Bibb, who was recently appointed to the Cuyahoga Community College Board of Directors, and I've actually worked a little closer with the Parma campus, the Dean of Students there. One of the things that they're trying to actually do, not just for this particular population, is really looking at the rate of individuals who post their 2-year go on to another facility, for a 4-year degree. So there's some of those numbers that at this particular point I don't have with me available, but I can gather them for you.
Okay, thank you.
Thank you.
Mr. Vasquez, of the 6,000 people that we expect to return from prison to Cuyahoga County this year, I'd like you to give me an estimate of what percentage of those do you think will receive reentry services in a pretty comprehensive way? In other words, we would or at least assess regarding their employment needs, their housing needs, their family needs, their psychological and physical well-being, and their education needs, kind of the full program. And secondly, how many, what percentage would not receive the full program but would receive some reentry services? And what remaining percentage would not receive any reentry services?
If you look at the figures that I provided for you in this particular packet, it starts with adult basic education, and you look at the North Star Neighborhood Reentry Research Center, you will see that from February 1st, 2011 through September 30, 2011, North Star provided 5,864 individual service contacts. And I also gave you sort of a plethora and a menu of the services that are being provided there. So I would say that at least 30% or maybe close to 30% or more of those individuals who are returning back, and again, not every individual returns back to our community. I'm going to say that, again, I cannot, do not quote me, but anecdotally, I'm going to say that around 10 to 15% might not be in need of any direct service. They're always in need of some services. Some will have a more need than others, and usually that's the case, just by the fact of the numbers that I provided for you. And this was, again, just the figures for this year, only not the entire year. So you can look at, if you project that, you can see that it could be close to over 6,500 services, maybe close to 7,000 as we close the year in December. So I think that, again, the case is very compelling, Mr. Chair, because of the numbers that are returning. I think that we're going to be able to get even a better assessment once we complete this year, particularly through this particular contract service provider. But I think the numbers sort of shows how the services are being utilized at this particular juncture.
Okay, I'd like if you could work with and try and hone in a little bit better on those percentages. But from what you're telling me, it sounds like a pretty high percentage are getting at least some services, and that's progress. Other questions?
Thank you.
I don't have, Mr. Chair, I have a question, but just a comment, but those people that do receive some kind of services clearly have a much lower rate of recidivism, and it's really, really a positive program. They are going to be teaching fish farming at Mansfield?
Mansfield Fraser, I believe.
Yeah, Mansfield Prison. They will be teaching fish farming, and some of the people are engaged in some of the agricultural processes, and that really works well because they don't have to have. We just solves a lot of issues when you're out there working in the outside. So these are really, really good programs. I'm on the advisory board at North Star, and it really is. I think some of you have been there. It is really, really a very, very positive program.
Thank you.
The only other comment I would have is there's some really significant studies that show that when you have formerly incarcerated persons working with the formerly incarcerated persons, that they have a good success record. So I don't know to the extent that your agency's been able to hire formerly incarcerated persons. They kind of speak the same language, and a lot of times they're really very, very helpful.
Well, we are the Office of Reentry. We do have one person who is a formerly incarcerated person who is in our office. Because I think you also have to lead by example as it pertains to this particular area. We're asking many of their entities who actually ban the box, so to speak, which the City of Cleveland has adopted that policy. Then we also need to lead the pack too.
And with those who have not been to North Star, I think some of you have. I would have certainly arranged that you go out there because it's a really good program.
Thank you.
Okay. Councilman Gerana.
Thank you, Mr. Chairman. I don't know if you said it today, but I've got this impression that more people coming out of prison come to Cuyahoga County than actually go to prison from Cuyahoga County. Can you tell me what that percentage is? And I'm just wondering, this is going to sound crazy, but I'm just wondering if our program is drawing prisoners to come to Cuyahoga County, ex-prisoners to come to Cuyahoga County.
That is an excellent question, Mr. Chair, and to Councilman Germana, because we're looking very closely and we're starting to see some evidence of that. Our office receives a number of letters. We have a staff attorney, Fred Balding, who is in charge of answering those letters. And we're starting to gather more and more letters from individuals who are not from this county, who are seeking and looking at the services that are provided in this county. So in terms of reentry services, we lead the pack, so to speak, in terms of comprehensive services, but we're getting more and more correspondence that comes straight from, and I read all the correspondence that comes from every individual that sends any letter to us, because we respond to those letters immediately in terms of what service they can seek in their own county versus Cuyahoga County per se. But I think that there is a very strong interest. I'm going to say that around probably 2 to 3%. And again, I cannot quantify the figure, are returning, coming back to Cuyahoga County that might necessarily emerge from this county. But that's something that we need to actually take a look at a little more closely and examine a little closely. And I'm just seeing that trend based on the letters that our office has been receiving.
In regards, I'm wondering if some of these inmates coming out, are they affecting our homeless rate?
Definitely. I know, I'm not sure if Ruth Gillette's still here with us, but she can attest to that, is that many individuals come on straight release. And when it comes on straight release, the Ohio Department of Veteran Corrections states to them, you did our time. It's not really their job to see where that person is going to be housed. Their job is, the ones that are in their system, is how they address their needs in their system. But many of them that come here on straight release, many of them end up at the homeless shelter. And that is a tremendous challenge that we have, because we have many individuals, because that's the only place that they can come to in terms from a housing standpoint, because of their emergency needs and their needs. So that's a compelling situation. I know that my colleague Ruth Gillespie can definitely attest to that. You're very accurate in that.
That's a problem.
Other questions?
Chairman, just to follow up on Councilman Germana's question. Sense is that when you have good services, you become a magnet. Now, I can imagine if you just mentioned they come back to the homeless services, but when they come to you, you have good numbers of outcomes for actually helping. If they are being drawn to your services and you're actually helping people, that's a good thing. My question is, in other arenas, we provide services at no cost for those who are part of the county. And when they're not, sometimes they charge a fee. I don't know if that's appropriate in this scenario, but is there anything like that going on? If there are people from out of the county receiving services, is there any type of contribution from their respective municipalities or from?
Let me answer the question in two ways.
Okay.
First of all, no, we don't have that kind of system set yet. But the other part, from a prevention standpoint, recently I was asked to be in the executive committee for Northeast Ohio for the Reentry Leadership Coalition Association. And part of my role in this executive committee representing Northeast Ohio is addressing this particular issue, is how do you build coalitions, because they're looking at our leadership coalition. I think it's important to note that we're part of the Greater Cleveland Reentry Strategy. Our leadership coalition is the largest coalition of reentry in the state, and is chaired by Chief William Dennehan, CEO of the Alcohol and Drug Addiction and Mental Health Services Board, and Vince Holler, our Chief Probation Officer. So they're looking at us as how we can assist in building those stronger coalitions statewide. We've had Ashtabula County, Stark County, Summit County, Shelby County, and Memphis, Tennessee has replicated our Greater Cleveland Reentry Strategy model. So I think through this process, we can begin to influence how do you build those systems in other counties so they don't have to utilize some of the services that are being presently utilized in our county. Hopefully that answers your question.
Thank you.
Anything else? Okay.
Thank you very much.
Thank you very much.
Thank you for the opportunity.
My colleagues, we have finished a little bit earlier than the maximum time that was allowed. And at this point, I would like to ask, we have now completed. Okay. We have now completed the hearing of departments and agencies, except for 4 large, very important agencies that are not directly under county government. And I would just ask if anybody has any comments, suggestions, anything for the good of the order in the process at this point.
Mr. Chair.
Council President Connolly.
Mr. Chair, I know since we are still in session and you have sent out a document and you sent out some suggestions, is it possible for us to discuss any of these now since we are still in public session? Or would you want to do that some other day? Okay, all right.
I'm
We don't want to
hearing-
discuss anything that's not in public. We might order pizza and get written up in the plain dealer. Yeah, we sent an email about pizza. We'll get in the plain dealer.
Okay, any other comments?
Mr.
Yes.
Chairman. And I want to support what President Connolly said this morning when she was questioning Health and Human Services about doing things legal. But I think it's important, the way I feel, and I'm sure all my colleagues feel, in our budget, we hope all departments are spending money on things that are legal and meet all the technical and ethical parts, just not the Health and Human Services part. of the budget, every department should only be putting the money on things that are legal. And, I think we weren't, and you weren't trying to pick on Health and Human Services, but I just think that's an important distinction.
Mr. Chairman, if I might, to respond to Councilman Germana's point, I mean, we are actually, in addition to being a department now under the new county government that is abiding by the new ethics legislation and the contracting process that you all have put in place, we are audited by the state and federal government. We have providers, or other funders that sometimes audit us. We are the subject of many external evaluations, and working very closely with the Office of Budget and Management, we endeavor to try to make sure that we use all of our funding appropriately, that we enter into appropriate kind of contracts. So I can't, although I believe this to be true of the rest of county government, I can only speak to human services. I think the other thing that I would proudly say of all of my colleagues who you've heard from today, I think we have a very good group of leaders who know their systems and their initiatives quite well. I think the one thing that when we all do individual budget presentations that doesn't shine through quite as much is the amount of interactivity that goes on between these departments. I mean, as I think you, in response to your questions, you certainly pointed out that we oftentimes serve overlapping families. So a family can be in the juvenile justice system, in the public assistance system, sometimes in the child welfare system. Our job as staff to these organizations is to try to break down the barriers that exist between these systems that sometimes, frankly, can do more harm to a family who's trying to work their way through a difficult situation if we are not sensitive to the fact that we're making many demands on them from various different sources. So I think that there's, again, what I don't think we had a chance to convey today perhaps is just the amount of coordination that goes on amongst all these systems to try to take all the funding that you all will provide to us through the budget and to try to use those resources not only as legally and ethically as we can, but also to try to not duplicate services and to try to deliver services that are sensitive to the needs of the families or individuals that we're serving. And I think we've had the opportunity in front of Councilman Brady's committee to talk about some of those interactions and overlaps and service coordination. That's hard to do when we're talking about individual budgets, but I did want to respond to your question, Councilman. And I also am very proud of the fact that, and I think this will be borne out next year with the Health and Human Service levy that's on the ballot, but even in the worst time in the county's history over the last couple of years, we passed the human service levy in 2010 with 66% of voters in Cuyahoga County who voted supporting that. I think that speaks to the fact that people believe in the services that the county provides, even if they, at the time, had lost some confidence in some of the county leadership. You, with your leadership and the county executives, give us the opportunity, I think, to reaffirm that commitment in the county through the Health and Human Service levy campaign of next year. Thank you.
Along that same lines, I would just add that the county is not currently running any programs that I don't support, and I probably speak for a lot of us in that, and it's what makes the budget process so difficult. It's not a matter of choosing between good and bad things. It's a matter of choosing between things that are good and other things that are really good, and those are tough decisions to make, and that's and we also have tough decisions to make as to how much we can spend and how much we can say, well, we'd really like to do this, that, and the other thing, but right now prudence doesn't allow it. So we have those kind of decisions to make. If there's nothing else, I'll ask the clerk if anyone has signed in for public comment as we close the meeting.
Mr. Chairman, no one has signed in to speak.
Okay, well then the next hearing on the budget process will be next Monday at 1 o'clock when we hear the Mental Health and the Adams Board and Disabilities and Health Department to close the hearing of agencies and departments. We are adjourned.